The doctor's uniform, an enduring symbol. The image of a doctor in a white coat is instantly recognizable. It evokes feelings of trust, authority, and hope. But have you ever stopped to wonder why doctors wear white coats? The answer lies in a fascinating history intertwined with science, symbolism, and cultural evolution. This seemingly simple garment reflects centuries of change in medical practice, embodying the very essence of the profession. From the earliest days of healing, healers have donned distinctive attire to differentiate themselves. In ancient civilizations, robes and headdresses signified their status and connection to the divine. The white coat, as we know it today, emerged in the late 19th century, marking a pivotal moment in the history of medicine. Its adoption coincided with groundbreaking discoveries in germ theory and the rise of antiseptic practices. From bloodletting to antisepsis, the evolution of hygiene. For centuries, medicine was shrouded in mystery and plagued by ineffective treatments. Practices like bloodletting, often performed in unhygienic conditions, were commonplace. The understanding of disease transmission was limited, and infections were a constant threat in medical settings. It wasn't until the mid-1800s that the pioneering work of scientists like Ignaz Semmelweis and Louis Pasteur shed light on the invisible world of germs and their role in spreading diseases. Semmelweis, a Hungarian physician, observed that the rates of childbirth fever were significantly higher in wards attended by medical students who came directly from autopsies. This observation led him to implement hand washing with chlorinated lime solutions, which dramatically reduced mortality rates. Around the same time, Louis Pasteur's groundbreaking experiments on fermentation and germ theory solidified the link between microorganisms and disease. Pasteur's work revolutionized medicine, paving the way for antiseptic techniques that transformed surgical practices. The rise of the white coat projecting cleanliness and trust. The adoption of the white coat in the late 19th century was more than just a fashion statement. It was a deliberate choice rooted in the principles of hygiene and the desire to project an image of cleanliness and professionalism. White, being easily soiled, served as a visual indicator of cleanliness, signifying that the wearer adhered to the highest standards of hygiene. Moreover, the white coat helped to establish a clear visual distinction between physicians and their patients. This distinction was particularly important in an era where quackery and medical fraud were rampant. The white coat, with its air of authority and professionalism, helped to instill confidence in patients, signaling that they were in the hands of a qualified and trustworthy medical practitioner. The white coat also served a practical purpose, providing a layer of protection for the doctor's clothing and allowing doctors to carry essential tools and instruments. A global perspective white coat. Customs around the world. The white coat, while widely recognized, is not a universal symbol of medicine. Different cultures and countries have their own customs and variations regarding medical attire. In some European countries, for example, doctors traditionally wore black coats, symbolizing formality and professionalism. In many parts of the world, particularly in developing countries, the white coat remains a powerful symbol of medical authority and expertise. It represents access to healthcare and the hope for healing. However, in some cultures, the white coat can also be associated with colonialism and Western medicine, leading to a more complex and nuanced perception. In recent years, there has been a growing debate about the role of the white coat in modern medicine. Beyond the white coat scrubs and the modern medical landscape, the 20th century witnessed a significant shift in medical attire with the introduction and widespread adoption of scrubs. Originally worn by surgeons and operating room staff, scrubs offered a more practical and hygienic alternative to traditional white coats. Made from durable, washable materials, scrubs could withstand frequent laundering and harsh disinfectants, crucial in maintaining sterility in clinical settings. The rise of scrubs coincided with a growing emphasis on infection control and the recognition of hospital-acquired infections as a significant threat. Scrubs, unlike white coats, were typically laundered within the hospital, minimizing the risk of introducing contaminants from outside environments. Moreover, the loose-fitting design of scrubs allowed for greater freedom of movement, crucial in fast-paced medical settings. Today, scrubs have become ubiquitous in hospitals and clinics worldwide. The psychology of attire. How uniforms influence perception. The clothes we wear are not merely a matter of personal style. They carry profound social and psychological significance. Uniforms in particular exert a powerful influence on how we perceive ourselves and others. The white coat, as a uniform, is no exception. Studies have shown that wearing a white coat can evoke a range of psychological effects, both on the wearer and the observer. For the wearer, donning a uniform can trigger a sense of responsibility, professionalism, and adherence to a specific code of conduct. The white coat, by virtue of its association with medicine, can instill a sense of purpose and commitment to patient care. For the observer, uniforms serve as powerful visual cues, conveying information about an individual's occupation, status, and trustworthiness. The white coat. Paradox, symbol of hope and anxiety. While the white coat is often viewed as a symbol of hope and healing, it can also evoke feelings of anxiety and fear in some patients. This paradoxical effect stems from the complex emotions associated with illness, vulnerability, and the medical experience. For some, the white coat represents the unknown, the possibility of bad news, and the potential for painful or invasive procedures. Moreover, the white coat can inadvertently contribute to a power imbalance in the doctor-patient relationship. The doctor, clad in the authority of the white coat, may appear distant or intimidating, while the patient, stripped of their usual attire, may feel exposed and vulnerable. This power dynamic can hinder open communication and shared decision-making, essential components of patient-centered care. Recognizing the potential for the white coat to evoke both positive and negative emotions is crucial for healthcare professionals. In this section, we delve into the future of the white coat, where tradition meets modernity. The debate surrounding the white coat reflects a broader conversation about the evolving nature of medicine and the doctor-patient relationship. As healthcare systems grapple with challenges of patient-centered care, cultural sensitivity, and infection control, the role of the white coat continues to be examined and redefined. Some institutions have opted to abandon the white coat altogether, citing concerns about infection control and the potential for creating barriers between doctors and patients. Others have embraced a more flexible approach, allowing individual departments or physicians to choose whether or not to wear white coats based on their specialty and patient population. The future of the white coat likely lies in finding a balance between tradition and modernity. Moving beyond doctors, let's explore white coats in other professions. The white coat, while synonymous with medicine, is not exclusive to the medical profession. A variety of other professions have adopted the white coat as a symbol of expertise, authority, and trustworthiness. Scientists, researchers, pharmacists, and even chefs have donned the white coat to signify their commitment to precision, cleanliness, and professional standards. In scientific laboratories, the white coat serves a dual purpose, protecting researchers from hazardous materials while also conveying an image of scientific rigor and objectivity. Pharmacists, responsible for dispensing medications and counseling patients, wear white coats to inspire confidence and convey their expertise in pharmaceuticals. The white coat, in these diverse contexts, represents a shared commitment to knowledge, skill, and ethical practice. In this section, we reflect on the enduring legacy of the white coat as a symbol of medicine's past, present, and future. The white coat, with its rich history and evolving symbolism, stands as a testament to the transformative journey of medicine. From its origins in 19th century hygiene practices to its modern-day interpretations, the white coat reflects the ongoing pursuit of knowledge, the commitment to patient well-being, and the ever-changing landscape of healthcare. While its future may be subject to debate and adaptation, the white coat's enduring legacy is undeniable. It serves as a powerful reminder of the responsibility entrusted to healthcare professionals, the privilege of serving others, and the unwavering pursuit of healing. As medicine continues to advance and evolve, the white coat will undoubtedly undergo further transformations. In our conclusion, we consider the white coat as a badge of honor and responsibility. The white coat, much more than a mere piece of clothing, embodies a legacy of scientific progress, ethical practice, and unwavering dedication to patient care. It symbolizes the transition from superstition to evidence-based medicine, from haphazard treatments to sterile techniques. While its interpretation and role may continue to evolve, its fundamental meaning remains unchanged, a badge of honor and responsibility worn by those who dedicate their lives to healing. Whether worn traditionally or reimagined for a new era, The white coat will continue to inspire trust, project professionalism, and symbolize the enduring human quest for health and well-being.